Well, today's the day, the third and final edition of a very special three-part Health Watch series on autism spectrum disorder. And boy, do we have a show lined up for you today. Stay tuned. Hello, I'm Terrence Affer Anderson, and this is Health Watch. So, this is it, the last edition of our special autism series. Thus far, we've explored definitions of autism, autism symptoms and treatment, the challenges faced by parents of children with autism, and we've taken a look at, as well at the host of available resources. I also closed last month's show with a new friend and a special co-host, 13-year-old Zavon Blair. So what do we have in store for you today? Something very special indeed. We're going to feature three rather incredible young people, and we also have a live studio audience. Give yourselves a round of applause. So you see, this is truly going to be a very special show indeed. And as always, we have some expert guests on board who will help guide us through this discussion. Let me introduce them to you. First up, I'm very pleased to introduce Dr. John Harrington, a professor of pediatrics at the Eastern Virginia Medical School and the division director of the EVMS General Academics Pediatric Division, based at the Children's Hospital of the King's Daughters. Dr. Harrington is also the parent of an autistic child, who we will feature on the show later in just a moment. Next up, I have the pleasure of introducing to you Dr. Maria Urbano, an associate clinical professor at the Eastern Virginia Medical School, Department of Psychiatry and Behavioral Sciences. On my left is the president of the Autism Society, Vonnie O'Keefe. Vonnie is also the parent of a child with autism spectrum disorder. And finally, someone who has been a guest for all three editions of this special edition, Dr. Eric Madron. Dr. Madron is a family physician with Bayview Physicians and is based in the offices of the Princess Anne Medical Associates. His son Ben also joined us and provided us with a very special treat that you'll see in just a few. But my other guests today, of course, are the members of our studio audience, and they are going to have the opportunity to ask some questions. So please make sure you stay tuned. Dr. Banner, I want to begin with a video that I got from you guys at EVMS. Okay. It features Travis Meeks. And I'd like for you to introduce that video by telling us a little bit about Travis and how it is that this video came into being.
Well, Travis was initially a patient of mine who came in for an evaluation. And as part of his evaluation, we sent him for neuropsychological testing, and it became clear that he had an expressive language disorder. So we spent time and worked with him and his speech therapist. The first thing we found out about Travis is that he needed glasses. And once he got glasses, he was able to focus more on people and talk with them a little bit more. Then we prescribed him some medicine for anxiety. And he relaxed a little bit more, so he became more social. And it became apparent at that time that Travis would be an excellent subject for our research trial using a new medication, D-cycloserine. And he was very successful in the trial. And we had a feed-forward mechanism. As Travis became a little bit more relaxed with his language, he became more social. And as he became more social, his language came along a little quicker. And with that, he became more independent. So he's been a very exciting patient and subject for our EVMS program.
I want to talk about that independence in just a second here. You said that you prescribed glasses, but he's not wearing glasses in the video. Are those contacts that he's wearing now? Or?
You know, I'm not absolutely sure, but I wouldn't be surprised.
Okay, okay. All right, well, let's take a look at the video.
Sure.
All right. Let's roll it.
Diagnosed with autism at 2.5. For Travis, it's always been hard to articulate and get his point across to people. EVMS has helped Travis to be more confident in the person that he should be. In one of Travis's sessions with Dr. Urbano here, we had always discussed about how Travis wants to ride trains and really enjoys trains. And she had suggested that we let Travis take the train by himself. Now, Travis will ask for me to let him take the tide so he can go to the mall. This is mainly so that he can have some time for himself and be more of a teenage boy the way he should be. It's opened up a world to him. it's really helped him to find his voice. He can actually go out there and talk to people and get around and make me feel a little bit more able to let go so I'm not smothering him and protecting him from the world. A woman last night who has a 15-year-old son who didn't know about the program and gave her Dr. Urbano's card before I left her and said, for your own state of mind, put him in this program. It will help him to be the person he's supposed to be. So you don't feel like what's going to happen to my child when he grows up. You like riding the tide?
Yes.
How do you feel when you ride the tide?
Better.
Better?
I want to take a moment to extend a special thanks to Mr. Justin Crutchfield, a media manager in the EVMS Video Digital Services Division, who produced that video on Travis Meeks, and who also made it possible for us to take a look at it today. You know, as I read this teleprompter here and I see Travis wearing glasses, I guess I'm the one that needed glasses, right? So tell me, though, I saw that in the video, the very first thing that I noticed is that he seemed to be determined to do things on his own. He appeared to be fiercely independent. Is that something that you see in people that you treat with autism?
Well, actually, there's two subgroups of young adults that we see. We see a group who are pretty comfy in their parents' home, like to be in their room, playing video games, and their parents are enough socialization for them. So it takes a little urging to get them to leave the nest. And then there's the other group who are very determined, but very afraid and fearful and anxious about social interactions or moving forward.
How do they make that transition from being anxious about it to actually stepping forward? Because it seemed like Travis made that accomplishment.
Well, I think a lot of support from his family was essential for Travis. I think his teachers supported him as well. And I think being in the research study gave him an opportunity to try some new medications in addition to the ones that he was using for anxiety. So I think a lot of attention from a lot of different directions helped him to make those beginning steps forward.
Now, you mentioned the research that you guys were doing. Tell us a bit more about the program that you're involved in.
Dr. Stephen Deutsch, our chairman, is our research director, and we have two clinical trials, one which has been completed, that's the D-cycloserine trial that Travis was part of, and we have positive results, I'm happy to say. And we have another trial right now using galantamine, which is another drug that we hope will help with emotion regulation.
What is it called again?
Galantamine.
Okay.
It's a long name.
Like that means a whole lot to me, but I was curious. Okay.
But we do more than just medications. We have a trial that Dr. Hartman and I are completing tomorrow using dialectical behavior therapy in group sessions for our adolescents and young adults. And we are doing a project with ODU and Dr. Chen's engineering students using robots or building robots together as a group to improve social interaction. And they're having a great time.
Very interesting. Dr. Harrington, when you were on before, we talked about the DSM-4 and 5 by the as defined by the American Psychiatric Association. And I also know that you attended the Pediatric Academic Society. And there was quite a bit of buzz about that, those two different classifications there. What is the DSM again? For those folks, our viewers that didn't see the first edition, tell us please again what that is.
I have an expert with me too. So the DSM is essentially a way to help diagnose diseases that we don't really have blood tests for that are in the psychiatric population. And in order to do that, you have to have a constellation of symptoms that will fit a diagnostic criteria. And that's really what the DSM-5 is trying to address. It's trying to address the idea that we don't have a perfect way to do this. And you know, the more we can do that, the more it will be standardized for each patient that's diagnosed with a certain illness. So there's a way for major depression, autism, and anxiety disorders and stuff. So in a sense, it hasn't been revised in a while. I think it's 15 or 20 years or so. So every revision, everybody gets nervous because, not only are we nervous that we're going to be changing some of the goalposts, if you will, but also even the physicians have to learn a new dialect and stuff. So I think that's really what was coming out at the meeting, is that, will things that we called autism be changed? And in a sense, everybody wants to think that newer is better, but everybody's comfortable with older if it happens to affect you. So I think that's really where the dialogue is at right now. And the new criteria haven't come out just yet. They're still waiting to be released. So everybody's sort of breathlessly waiting to see if they made any last changes to the final draft that was up and available for comment. Because if you change something from an and to an or, you can have a very different effect on diagnosis.
Certainly. And the DSM, again, is an acronym for?
It's a Diagnostic Statistical Manual for mental disorders.
Now tell us about the program at CHKD and your experience treating people, and then I'm going to ask you to introduce your son.
So our program is not really necessarily a program. It's sort of a group of people working together and stuff. Our pediatrics department, I tend to be the main person where children will come in and be evaluated. I connect them with services like TASA, like Vanna's TASA, Tidewater Autism Society of America. I connect them with other services that they can get through Autism Speaks that they can download into for a resource. And I help them with different things. Maria has great stuff for the kids who are moving from adulthood and stuff, so I can send kids to her. In the younger groups, I usually send them to TASA and get them involved along those. If there's early intervention that works well, I try and find ABA therapies. They're difficult to find. That's another thing that we'll talk about, hopefully. Our group, I also have Corey Allen, who will be moving, but she was doing a lot of the evaluations for us. She's a psychologist and was doing evaluations, which utilizes the ADOS, the Autism Diagnostic Observation Schedule, which is supposed to, it's the sort of gold standard for diagnosis and stuff. But people have been trying to move that around a little bit because it takes a little while to get that done, and so there are issues like that for getting a diagnosis. It does take a little bit of time, and there can be quite long wait lists in order to be seen. Some of the neurodevelopmentalists in our areas, it might be up to 9 months to a year before you see them.
Really? I see. I'm anxious to get to the video with Sean. Why don't you tell us about that?
So Sean has always loved being in the water. When he was about 3 or 4 years old, he used to like to float. And the lifeguard would get nervous that he was, drowned because he would float like a dead man's float. But he just loved sort of the buoyancy of the water. And when we moved to Virginia, we were kicked out of the pool by the swim team. And we were like, well, I guess we have to join the swim team. So we joined the swim team, and that was about 4 years ago. Since then, he's really progressed as a swimmer. And he was on his high school swim team and then has become one of their better swimmers on the team. So this was presented to the coach, and the coach decided to admit him for Student Athlete of the Week. And that's essentially, they accepted him as Student Athlete of the Week and then produced a 2-minute video of that.
Well, since let's continue with the sports motif. Let's go to the tape.
Let's go with the tape.
Yes.
It's 6:07 a.m., and we're at a place called the Outdoor Bubble. It's located on the grounds of the Greenbrier YMCA. Through these doors are 40 swimmers from Grassfield High School, swimming laps back and forth every morning. They are training for their next meet. But they aren't just racing against other schools. They're racing against time. You see, a good time can automatically propel you in the regional meet. One Grassfield swimmer has already swam a qualifying cut time. There he is. That's Sean Harrington. What's his favorite stroke?
My favorite stroke is 100 fly because I wanted to break my school record.
His record is 1:02.9. He was less than a second away from making the state's finals last year. Back in the water, he's determined to break it. What pushes him?
I like swimming more than other sports I like. And because I don't used to do track, I like swimming better.
Did I mention Sean is a swimmer with autism? It hasn't slowed him down one bit. Just ask Dad.
Children with autism like repetitive things, so it seems to make sense that they'd like to swim back and forth and back and forth. You and I probably would think it's crazy. How am I going to swim this far all the time, every day?
yet he'll do it 2 to 3 hours and never seem like he's really tired. It's a pretty amazing thing.
What's Sean like as a teammate?
He's probably about the happiest person on the team. You know, you go to talk to him, he's always got a smile, nice things to say. He finishes a race. You know, the first thing he does is congratulate you, even though he already won.
What does he think about Sean's autism?
He's so good at swimming, and honestly, I didn't even know until someone told me.
Besides swimming, Sean is an accomplished trumpet player. He's been second chair at the region and state levels, an accomplishment that's hard to achieve. But swimming is his first love, and he's focused on one thing.
I wanted to break my school record because I wanted to get under a minute, because I wanted to break it.
Do you think you can break it this year?
Yeah, I want to do that. I want to break it.
At the pool with our Student Athlete of the Week, Barbara Sierra, News Channel 3.
I also want to take a moment now to extend a special thanks to Mr. Kevin Rafferty, the News Operations Manager at WTKR-TV, News Channel 3, for producing that special video on Sean and making it available to us. Dr. Harrington, I want to come back to you. I'm losing my voice here, but I want to come back to you here. You mentioned that Sean took to the water at an early age. Do you think that being in the water has some therapeutic value for him?
At least for him it did. I mean, we always were, he always had a lot of energy, and that energy would be taken out into either tantrums or, you know, not sleeping well and stuff like that. So I used it as we initially tried to get him to run. That's why he didn't like track. But I liked the track because he liked the numbers, so he'd go around 1, 2, 3. I made him go around each number and stuff, so he was able to do that. But the swimming part he really enjoyed and could get tired. So at the end of the day, when both my wife and I were exhausted, we could say, go to bed. And, you know, for some parents, initially with their child with autism, you just want to sleep. And that was really key because he was not a good sleeper. So when we knew he could swim until exhaustion, we were happy with that.
Good. Let's talk a little bit about how your experience as being a parent of a child with autism, how that has impacted the work that you do professionally. How has that had any bearing at all on your work?
So, I mean, it's basically changed my whole trajectory of life. I mean, essentially, now, you know, even when I go to work this morning, I had 12 patients that I saw this morning. Half of them had autism. So, you know, my other partners are always like, that's Dr. Harrington's patient, you know. So we've learned to sort of, I've learned to sort of just roll with it and understand that, you know, I'm going to have more complexity to my care. Dr. Madron probably can match me with most of the things and stuff, but I just enjoy it. I know what they need. I know how they're feeling. I've been through it. I can understand that empathetic-wise, and how difficult it is, and how each parent plays a critical role. And when there's only one parent, I realize I can't empathize with that, but I can tell them, you know, if you can get the other parent to help, that's going to really be helpful to you. So a lot of it's kind of a little bit hand-holding, but also providing resources and information and just a listening ear sometimes.
You had already seen 12 patients today before you came?
Yes.
That's pretty good. And 50% of those were patients with autism?
Yes.
Okay, that's a pretty good size portion of your practice.
Yes.
Vania, would you tell us please about your own experiences as being a parent of a child with autism?
Sure. My son Sean is now 7.
It just happens to be named Sean as well.
Okay. It's a great name.
Yeah, how about it?
He was diagnosed about a month before his 3rd birthday. He was developing typically, and around 17, 18 months of age, we started to notice some changes. He lost the little bit of language that he had. He started to withdraw from us. He would sit in the corner, and I would walk into a room, and it was as if no one had walked into the room.
I'm sorry, what age was this again?
This was probably about 18 months, 19 months.
Okay.
And so we started to notice these changes. He would play with toys differently than my friends' kids. He wouldn't play with cars the way I have 2 friends and a brother with sons a similar age, and this was my first baby, so I really didn't know much about it. And they would be playing cars and make car noises, and Sean would line his up, and he would line them up by color. and then, or he would do different orders, different patterns all the time, and then he would knock them down and watch them hit the floor, and then he would pick them up and they would go back in the exact same pattern. It was amazing, but red flags started to go off that probably wasn't typical behavior in a 18, 19-month-old. He tantrumed a lot. That started about 17 months, and it just got worse and worse. He would headbang. He basically lost all ability to communicate. He would cry for hours and I wouldn't know what was wrong because he couldn't tell me. He couldn't tell me he was thirsty. He couldn't tell me he was hungry. He couldn't point. So we started early infant intervention, and at that point I still had no idea what autism was. Nobody even mentioned the word autism to me. His preschool teacher, and this was just a regular preschool teacher, kind of mentioned it, said, you know, Sean doesn't color like the other kids do. And I said, well, what do you mean? And she said, well, he's just a little different. And I said, well, have you ever seen a child like Sean? And she said, once, and that child had autism. And that was the first time anyone said autism. So right away I started researching, and then we got the diagnosis about a month before his 3rd birthday.
You know, when I had Angel on the show, who's in the audience now, she mentioned that when she heard the word autism, she first thought of the movie Rain Man. That was her only affiliation. Did that cross your mind as well? Yes, that was the only time. I didn't know anyone who had autism. I didn't know anyone whose children had autism at that time, and that was my only frame of reference as well, was that movie. For there to be such a radical change in his behavior over a condensed period of time, that must have really gotten your attention. Yes. Yeah. How does your experience, or did your experience, what role did it play in the role that you currently play with the Taiwan Autism Society? Well, how did that come into being? Getting the diagnosis is a very terrifying and isolating experience. You really feel, I really felt alone, and I felt like I had nowhere to turn. And in my research, I learned about the Autism Society, and I went to one of the 5K runs, and I brought my husband, and I brought my son, and my daughter, who was a baby at the time. And a mom came up to me, and she introduced herself, and she asked if I needed help. And right then I started to cry. And she talked to me for about 2 hours, and a whole world opened up to me. And I realized I wasn't alone. And I realized that I knew I could do this, because right away I kind of took the bull by the horns and said, all right, this is something I'm going to fix. I'm going to do this. And I kind of devoted my life to helping my son. But I felt that I could get some help doing it, more so than I did before. I felt like it was just me in the world doing it. Understood. And now I feel like I have a team. So what that mom did for me, I wanted to do for other parents. So I don't do it as well as she does, but I try hard. I try hard to make sure other parents feel like they have someone on their team and they're not alone in the process. And that's how you got involved with the Autism Society? It is. I started to attend meetings, and I became a board member, and then was elected president about 2.5 years ago. Might that mom have been Teresa? It was Teresa. Okay. All righty. I want to get back to my scripted questions here, because I'm having to resist the temptation to just go completely off the script here, but because the one thing in particular that you spoke about in terms of the tantrum, I wanted to ask all of you if that in fact is something that you typically see. Yeah, because I know someone that referred to you, Dr. Madgen, who was having an incredible issue with an older child, and I'm hoping that she does in fact reach out to you. So that is something that you do in fact typically see with younger children?
I think one of the issues, patients with autism typically have a communication disorder of some sort, and so if they have a delay in language development, as Sean did, they have frustration about how to communicate effectively with those around them. And so the ways that they learn to communicate, unfortunately, wind up oftentimes being negative behavior. I see. Okay, let me come back to you, Vanny. I know, I'd rather gather that the incidents, that each case is kind of unique with the child, but do the parents, when they come to you, they tend to have similar concerns, I guess? They do. Okay. And every story may be different, but you do have, for example, you do have the group of parents whose child started to show signs of autism at a very early age. And then you have children who are parents like myself, whose child kind of regressed into autism and was developing typically, and then all of a sudden started to lose skills. But all
parents have the same issues. They all want to find out what they can do to help their child. They all want to try to find out what they can do to help them navigate the school systems, to help them find services, to help them figure out how to pay for services, to help them figure out how to help their child make friends and socialize, to help them, increase language, to help with potty training. These are all things that all parents have these questions and these issues. And as children grow, obviously their needs, when they become teens and young adults, their needs change a little bit.
Tell us about the Autism 101 program that you have at the Society.
We're very excited about this program. We noticed families coming to see us in greater numbers, obviously, because the incidence of autism has increased dramatically. So we put together a program whereby families come in and they sit in our office by appointment. So it's just us and the family. And we sit in there for 1 to 2 hours with them. And we kind of give them a roadmap, because you get this diagnosis. And it's a lot better now. But in the past, you would get this diagnosis and the doctor would say, okay, well, good luck to you. We wish you the best. And that was it. And families kind of were on their own. Now, doctors are giving parents a little bit more guidance. But they come to us, and a lot of times they're deer in headlights. And if they've just gotten that initial diagnosis, they don't always have time to ask the doctor a lot of questions. So they come into us and they're nervous. They don't know what to do first. They might know they have to do these 20 things, but they don't know what priority they should put those things in.
Understood.
And so we kind of give them a roadmap. We give them all their options in terms of services, in terms of different things that they can do for their children, different school settings, different therapies. And they leave with this binder, which is our new family packet. And it's chock full of information. It contains our resource directory. It contains Medicaid waiver information, educational rights and guidelines, and they leave with a roadmap of what to do. And then we kind of keep checking in with them in case they have any follow-up questions or need any additional guidance. And the main thing they leave with is hope, that they're not alone and that there's someone there who can help them through the process.
I can pretty much guarantee you that with our expanding audience here with HealthWatch, because we started in the city of Norfolk and now we cover pretty much the entire metropolitan area, that there are people out there that are watching that are probably in a similar situation that you were in when you first made this discovery. So I'm glad that we had an opportunity to talk about that. And I want to take a bit of a break now. And after we take this break, I want to come back to you and talk about the GFF program, and I'll just leave our viewers in suspense. Okay. And then we're going to come back to you and talk about, you've been with us for all 3 editions of the show, but we want you to introduce our special guest that was in the studio today. All right, so we're going to take a bit of a break now, and when we come back, we're going to talk a little bit more with my esteemed guest here about autism spectrum disorder. Stay with us.
I think someone at my friend's school has this thing called autism. My friend's brother's son has autism. My neighbor's son has autism. My son has autism.
Autism is getting closer to home. Today, 1 in 110 children is diagnosed with autism. That's a 600% increase in the last 20 years. Learn the signs at autismspeaks.org.
Welcome back. We're having some very engaging and insightful discussion about autism spectrum disorder. And we're going to jump right back into that discussion now. Vanny, I want to come right back to you. You have another program there that the title I really like, GFF.
Yes.
I have a few GFFs. No BFFs, but tell us about GFF.
Well, GFF is a great program we've been doing for about a year now. And basically we go into schools. That's our main audience is elementary and middle school students. But we also go to Boy Scout meetings and church youth groups. And we go in, and Angel and I do an assembly for the kids, and we do a presentation, and then we show a really great video. There's 2. There's one that's geared towards elementary school students, and there's one for middle school students. And it's basically teaching them how to be a GFF, a good friend forever. And we received permission from the producers to incorporate that in our program. And the purpose of this is to educate young people about autism, and so that they understand that these children are in school with them, and they can befriend them and be kind to them no matter what, even if they're different than them. And then the whole purpose is to try to decrease bullying, which is a huge issue with our population.
So it's all really about education and education of the young people as well.
It is.
Yeah. Dr. Madron, you've been on board with us for all 3 editions.
That's right.
And I've been very delighted to have you on board. And we've also had the opportunity to talk personally on occasion about your son, Ben. And again, he played for us earlier. How you doing, Ben? I see. He's in the audience. And he played for us. He played cello. And I want you to introduce that for us. And we're going to roll that tape in.
Sure. Well, my son Ben is 15 now, and when he was younger, Ben had very little communication, and we weren't really sure what the future held for him. And I have to say that my wife and I are thrilled with how far he's come and what an accomplished young man he's become in terms of he's a very intelligent and very successful student, and also has done very well in the field of music. Neither my wife or I have any musical talent, so not sure where this came from, but Ben's been playing the cello now for about 5 years, and appreciate you offering him the opportunity to play here today.
Well, he's certainly entertained us. And your daughter plays viola?
She plays the viola and the harp.
And the harp. And Ben is 15 and your daughter is 12.
She's 12, that's right.
Okay. Without any further ado, I don't want to tease anybody any longer. You know, let's go right to Ben playing cello. Ladies and gentlemen, Ben Madron. Fantastic. I share with you, Ben, my favorite cellist, of course, is Yo-Yo Ma, the master cellist. She has nothing on you.
Now you have a second favorite, right?
Yeah, absolutely. Second master cellist. Thank you. And thank you for joining us today to do that for us. Okay. As a family physician with Bayview Physicians based at Princess Anne Medical Associates, how different is the care that you see? Because you provide care to children and adults, is that correct?
That's right.
And how different is that care?
I do general family medicine, so I see patients of all ages and all different sorts of medical problems. I see newborn babies, and I see great-grandmas and everything in between. But I've developed a particular interest in treating patients with autism spectrum disorder since I have a child with autism, and like Dr. Harrington described, it sort of draws you into this area of practice, and I think my experience is similar. It's close to half of my patient population nowadays is patients with autism or family members of patients with autism. And it's been a very rewarding area of practice. It's just a lot of fun to see patients as they progress and improve as time goes forward. In terms of the differences between providing care to children versus adults with autism spectrum disorders, I think in general the goals that families are looking for in terms of treating their patients with autism are not that different between childhood and adulthood. You know, everyone wants the best care possible for their loved one. One big difference, I think, though, is in terms of who's being the advocate for the patient. For children, of course, have a natural advocate in their parents.
Absolutely.
And many parents of adult children with autism wind up being that extended advocate, I guess, if you say, well into their child's adult years. But sometimes parents aren't around, and someone else has to serve as a surrogate advocate for the patient, especially if they're not able to advocate for themselves.
So those resources in the community are very important. I want to come back to you with another question here about those resources. But for our studio audience, what I want to do is make sure that we give them an opportunity to ask questions. So whoever, I know that you had a question, Mr. Humphrey, do you not? Okay. I want to have you approach the microphone now, but I'm going to ask Dr. Madgen another question. You can just come up to the mic. I'm going to ask Dr. Madgen another question before we get there. Again, we're talking about different resources in the community. How does the need for resources differ between an adult and a child? And this is something we can ask you as well.
Many of the resources that children who have autism take advantage of are school-based resources. And so outside of the school system, I think that's where the community, we're still figuring out ways to develop programs for adults, whether it be support for employment, independent living kind of resources. Many patients with autism who are able to function in a semi-independent manner but may still need some assistance with certain areas of their daily living.
I see. And finally, what percentage of the clients that come to you are adults? Any idea?
It's about 30%. We've had in the past. I
didn't realize it was that large.
In the last 12 months, we've had approximately 354 Autism 101s in our office in our 3-day schedule, and approximately 30% have been family members of teens and young adults who come in looking for services. Some are new to the Autism Society, even though their loved one received a diagnosis years ago, and some have been around but are just have different questions now that their loved one is growing up.
I see. I see. Sir, if you could please again tell us your name. And,
my name is Todd.
Todd, and who do you want to address your question to?
Dr. Madgen.
Okay.
And my question is, my wife and I have had a hard time with our health insurance company covering some of the recommended therapy services for my son who's autistic. Can you tell me what the government's plan is, the idea behind what they're doing to address that?
This has been a very challenging issue for many families, and not just here locally, but I think nationwide. There's been slow to adapt, I think, the healthcare industry to the healthcare needs of patients with autism. And so health insurance, until not that long ago, would very commonly exclude coverage for traditional therapies that we know are effective in terms of treating patients with autism, including speech therapy, occupational therapy, and ABA, which is applied behavioral analysis that Dr. Harrington referred to earlier. In Virginia, in 2011, the state legislature passed a law which will require health insurance companies to provide coverage for these sorts of services going forward, and it's been a slow process in terms of getting this implemented. There's unfortunately quite a few limitations in terms of what is covered. The core services that I just mentioned are covered, but only up through age 6. And also there are some exclusions related to the employer. So in this case, if you have a health insurance plan and you're with a small company that has fewer than 50 employees, they're exempt from this coverage. Or if you're with a very large company that is self-insured, they're also exempt from this coverage. So there's a lot of limitations. It's definitely a step in the right direction, but we still have some work to do as a community.
A lot more work to do. It sounds like a lot more work. I want to take, if there's anyone else from the audience that has a question, do please come up to the microphone. And while we're doing that, I want to ask you guys, what do you think are the greatest challenges that the parent of a child with autism faces?
Well, I think especially for parents of younger children, it's accessibility to services. I mean, autism is treatable. There are treatments that can help a child become a successful member of society. And unfortunately, those services are very difficult to come by. Both doctors mentioned ABA. There's a long waiting list for ABA therapy in our area. And even if you're lucky enough to find a provider who can work with your child, it's very difficult to pay for ABA. Insurance does not cover ABA right now. The law was passed, but unfortunately, in the 11th hour, they added some licensing requirements, and that hasn't really come about yet. Unless an employer specifically adds autism coverage to their benefit package, it's very difficult to get autism covered. I haven't met many families at all, I mean, maybe on one hand, that have had ABA covered by their health insurance. I know I haven't for my son. So it's very difficult to get a treatment that you know can make your child's life better, but you can't afford it. It's very challenging for families.
I can well imagine. We have another question from the audience.
Hello, I'm Angel. My question is actually directed toward Dr. Harrington or any of the physicians that are here. In regards to your definitions of functioning levels, there's a lot of families who have misconceptions about the functioning levels of individuals with autism. Some people say low functioning, some people say high functioning. What exactly does functioning level mean in regards to that?
So it's a good question. In terms of how the DSM-5 is trying to handle it, they're trying to give it severity level ratings from 3, 2 to 1, 3 being the most severe, basically impacting your ability to function in the world. And then 2 would be moderate dysfunction, and 1 would be mild dysfunction. So how do you represent that in terms? So it would probably be language-based, repetitive and restrictive behaviors, which might become obsessive, which make it hard for you to continue doing what you're doing, and interacting, your social communication, your social interactions and stuff. And those will be given a severity level rating. And this is to help that sort of thing where, you know, I have a mild case, or I have a moderate case, or I have Asperger's, what does that mean? So apparently the DSM-5 has done this in order to help, you know, fix this problem of when we have a child with autism, and sort of how do we rate them in terms of severity. And you know, each parent, you know, feels differently about their child. Well, they're not that severe, you know, why do they have a severity level? And you know, no matter how we divide it, it's going to be what services are needed, how much services will be needed for this level of severity. So I think the idea was to match the services with the severity level rating. So if you have a 3, you should get more services. If you have a 1, you would get less services. You know, I'm not a bean counter, so I don't know how that's going to match out to what services are available in the community. So it's a really difficult scenario, especially when you talk about, and you know, not to be political, but if you're in a blue state versus a red state, there's a lot of different money that's available in different states for that. So, and you know, some people just move, and that's what some people decide to do. Some people try to change things where they are.
You know, I want to share with our audience that there are likely people that will see this at home that will get a question in mind that will not get an opportunity to ask a question. So don't be bashful. If you have something that you'd like to ask, just step up to the mic. But what I would also like to address is we've spoken about the challenges that parents face. And we've kind of touched upon this with all of you professionals. But the medical community, as well as the service communities, face your own challenges in dealing with autism. Can you address that, Dr. Brown? Can you speak on that?
I think the most difficult part for me is when I have a patient come in for evaluation. I can say, yes, I can do a psychiatric evaluation, I can send you for psychological testing, I can prescribe medication, and there are some therapists in the community, but that's sort of the end. The resource book that we have is Vanya's, and there are very few that work with adolescents and adults. So I feel that I don't have much to offer, you know, when it comes to vocational or social, you know, or independent living. They're just such great areas of need, and usually when you're a doctor, you have a plan that you can prescribe. And it would be nice to be able to prescribe those other pieces, but they're not in place.
You know, that's something that I'm not sure if it was you, Dr. Harrington, or you, Dr. Madron, that wanted to address the challenges of assisted living for people with autism. So I want to come to that if we get an opportunity. But we have another question. Your name?
Yes, I'm Maxine.
Okay.
I have a question for Dr. Harrington. What is the best way to discipline a high-functioning child with autism who has figured out how to control the situation using his or her condition? And how do you determine if the misbehavior is age-appropriate versus a trigger from the autism?
Thank you.
Are you sure you're not a clinician, huh?
And in the 30 seconds that I have to answer that, Usually I tell parents, especially if it's a behavior that's, affecting you specifically, you have to sort of look at that behavior and understand what's driving the behavior. What's he trying to get from that behavior? All of us are always thinking in terms of ABCs about behaviors. What happened before, what's the behavior, and what's the consequence? With adolescents or the older group, usually it's the consequence. So what happens when they do that behavior? What do they get from that? If it's consistently that they don't get what they're asking for because you don't want them to get it, then that's probably okay. If they get it intermittently, then you're providing a positive reinforcement on and off. So that may be what the problem is. I realize if they're using their autism to do that, that's a bit of a tricky edge, but I would treat them more normally if they're doing that. Then you would say, listen, you may have autism, but we have some rules here, and these are the rules. And just make the rules very specific and very very specific, and make the consequences the same each time. And it should modify the behavior. I won't promise that, but it should.
There are likely adults that have autism that live independently, correct?
Yes.
Yeah. And do they live in environments? What I'm trying to get at is if there are assisted living environments that they find themselves in, or they just live completely independently?
Most of them, if they live independently, which is really a very small amount.
It is. Okay.
And some of the more recent figures have been 4 to 5%.
Really?
Of adults with autism live independently.
Okay.
They have a lot of family support nearby, like either down the block or in the same building.
I see.
Because they need help with the everyday activities of managing their money, going to buy groceries.
I need that kind of help.
Managing to get their laundry done. So just the everyday supports are desperately needed.
What do you guys find most rewarding about your work?
Getting to know families over time. It's what's always attracted me to family medicine to begin with, is the continuity of care over time. And this is just one more aspect of that, is getting to know families, and families that I can relate to personally about something that they're really struggling with.
I recently heard on NPR, they were talking about the responsibility of school systems and people in the community that deal with children that have food allergies. But I would imagine, and you touched upon it earlier, that education of the community at large, people that do not have any immediate relationship with autism, in the event that they encounter people with autism, it seems to me that would be good for them to be aware. And you kind of touched upon that.
Well, young people are only in school up until 12 years, usually the age of 21, they transition out of high school. So, I mean, they're going to go into the real world. So they're going to be in contact with other people and kind of go outside of their bubble comfort zone. And with the incidence of autism rising as much as it has, pretty soon it's safe to say that everyone will know someone with autism, whether in their immediate family or their extended family or a classmate. I mean, even I have a teenager, and I remember when I was in high school, I didn't know anyone who had autism. I'd never even heard the word mentioned. And my daughter, who's a junior in high school, actually has 3 in her general education class, 3 individuals with autism. So it's becoming more of a norm to have these children in regular classes. And kids these days are coming into contact with them more, learning how to live with them, learning how to better support them. And so it's important that the community become educated too, so that they can hire these individuals, work with them, live with them. It's got to be a community effort. It can't just be within the school systems or within the Autism Society. It's got to be everyone.
Well, Ben, I have to tell you, you played Humoresque earlier. I think that my stomach is now doing an aria to accompany your cello. I should have eaten. You've had 12 patients. I should have had 12 snacks. So I also wanted to talk about what we thought that the future held for autism research. I mean, the change between the DSM-4 and the DSM-5. So there are the definitive changes that are being made, like the new autism, was an autism insurance law. So what do you guys think that the future holds?
Genetics. By far and away, there is a tremendous amount of research in psychiatric genetics. and that's leading to a tremendous amount of information about neuroscience and how the brain of people with autism is connected and wired differently than people who do not have autism. And that is very exciting. And in fact, one of the controversies with the DSM-5 is that NIMH, National Institute of Mental Health, the director there was saying, you know, basically DSM is a phenomenological document. It's just descriptive. And he's hoping in the next 10 years that we will have an etiological or causative document for autism, so that maybe we'll know in the next 10 years why people have autism. And a lot of that will be genetically driven.
Has there been any change in the diagnosis procedure? Are we seeing more people that are diagnosed with autism than, say, 20, 30 years ago?
No question. It's the incidence of autism has increased within the last several decades. The reasons behind that are totally unclear, but I think, as Vanya just pointed out, it's getting to the point where almost everybody knows somebody with autism.
Now, do you think that that's because we've gotten better at diagnosing?
I think that's certainly part of it. We as physicians become more comfortable with the evaluation and treatment, and we're better able to recognize the patterns that the DSM describes.
Okay.
The Virginia Department of Education has a wonderful graph, which I don't know the numbers on, but just looks, if you look at it, it is this steep incline of the number of students in Virginia school systems, and that it keeps going up way into the transition years, high school, you know, as well.
I think, I mean, just to add into the DSM-5, if the criteria become a little more stringent, half of the kids diagnosed with autism in some of the studies are showing that if they may not meet the criteria, it's not that people will have the diagnosis taken away from them if they already have the diagnosis. Right. But I do think that the pipeline coming in, it may be more difficult to say this is an autism spectrum disorder, and that might make the numbers go down artificially, if you will, if you're thinking in terms of what we were calling what we're calling autism is no longer being called autism. And I think that's the tricky part about this, is that I don't think we're going to go retrospectively back and say my son who's 17 no longer has autism because he's speaking better now and he has less repetitive and behavior skills and stuff like that, so we're now going to de-diagnose you. I think what's going to happen is that coming into the diagnosis, you're not going to use this term like, well, he's got a mild case of it, we're not really sure, but let's just call it autism for now until we figure out later. So I think that's the process that's going to happen a little more stringently with the DSM-5, which say it's bad or good, it's going to at least make it standardized. Whereas before, I think there was a lot of leeway in making a diagnosis in terms of how many items you had to have. It looked like you needed about 5 out of 17 items. Now you're going to need about 4 or 5 out of 7 items. And so that's going to make it a little harder to make a diagnosis in some cases. So it remains to be seen what the DSM-5 is, though. So we're waiting to see, because that could be 5 out of 9 or 5 out of 7, depending on how they change the wording and stuff. So.
Okay.
And Terrence, if I could just
Certainly.
piggyback for a second.
We got about 4 minutes left here.
Real quick.
No, go right ahead. As long as you don't take 4 minutes.
The incidence of autism rising the way it has,
right.
I want to make sure the audience understands, and I'm not a physician, but I don't believe that it's just better diagnosis, and I do believe that doctors have gotten a lot better at diagnosing. But I think what Dr. Madron said was important. We don't really know the exact reason why the numbers are the way they are. Autism is a puzzle piece. I don't know. Hopefully, we will know someday. It could be a number of factors kind of rolled into one, in addition to being more genetically susceptible. But I think the important thing to focus on is the lack of services for these children. And I really do hope that we find the cause of autism and figure out, how to maybe reduce the incidence. But we also need to worry about the children that are already here and what we can do to make their lives better and help them become more productive members of society. And I'd love more resources to focus on that as well.
Okay, we have just a few minutes left, so the two of you have just spoken, Dr. Madron and then Dr. Urbano, very quickly, if you have something that you wanted to add.
The heterogeneity of this disorder, I think, is
now
really
you're
something.
using a big word, like heterogeneity.
It's a spectrum disorder, I think, and there's a lot of variety in terms of how patients present, both in terms of their early history as well as how they progress as time goes forward. And describing autism in its according to behavioral characteristics, which is what the DSM manual does, limits us in terms of our availability to identify subgroups within this patient population. So to go back to your question before about, what do I envision in the future, I think we're going to look back, 30, 40, 50 years from now at the way we approached autism in 2013, and we're going to say, what were they thinking back then? Because it's clear that this type is treated this way, and this type is treated that way, and this type is treated completely different.
Okay, Dr. Bano, you have the last word.
I would like to put in a plug for our colleagues in Richmond. Virginia Commonwealth University has the Autism Center for Excellence. They have a wonderful website. They were given a Virginia Department of Education grant and just have tremendous amounts of educational material on that grant, webcasts, courses you can sign up to take at all different levels. So it's definitely worth visiting that website. It's VCU ACE.
Beautiful. Now, guys, we're going to have to close, regrettably. We ran out of time again with even an hour, so we definitely have to do this again, and I think it would be a good idea to bring on a legislator. I want to thank you all for coming on and joining us today, and I want to thank our audience as well. Give yourselves another round of applause. Big audience. Thank you so very much. And we're going to do a special closing today. We're going to close with, Ben is going to take us with a piece that is popularly known as Smoke on the Water. We're going to get to that in just one second. And I want to thank our viewers for joining us today. Guys, thank you all so very much for joining us. Thank you for joining us. Again, my name is Terrence Affrey Anderson, and this has been Health Watch. If you'd like to send any questions to me, you can email me at terrence.affrey-anderson@vdh.virginia.gov. You can also give me a call, of course, at 757-683-8836. And you can find previous editions of Health Watch online at Norfolk.gov. Just click on the Norfolk tab, the Norfolk TV tab, for a listing of all the shows produced by the prolific Norfolk Neighborhood Network. Guys, again, thank you so very much. We're going to close with Ben Madron. I'm Terrence Affrey Anderson, and this has been Health Watch.